Get to Dr. Russ LaFrance, and he is on the phone with us from Hamilton Orthopedics and Surgery and Sports Medicine. And this is going to really tie in. This is going to really tie into our next guest, who's going to join us after the doctor. Good morning, doctor. How are you doing?
Good, thanks. How are you guys this morning?
Not bad. And I'm just teasing, and if she can wait for us, we have Erin Hamlin on the line following you, and so we could talk to her a little bit about sports and maybe some of the injuries and what it's like for her. But we're going to focus here a little bit this morning on ACL injuries, and I think a lot of folks, whether it be on a high school level or you get into college play or you were involved with one of those maybe, and you know your younger days, and you become older. You hear ACL injuries quite a bit. You hear people talk about them. Can you explain to us what exactly an ACL is and the injuries that could ensue?
The ACL is one of the four main ligaments in the knee, and it's probably the most common injured ligament that we see in the knee. And everyone gets a little bit anxious when you talk about it because it's a big reconstruction. It's a big surgery. It's an injury we see usually in 20-year-olds, typically in athletes. We see it usually in non-contact type injuries, a lot of soccer, a lot of football injuries as well, but those usually aren't with contact. It's usually when the guy's running down the field and it goes to plant and cut, change directions, and you feel a pop in his knee. You get a lot of swelling, and then the knee becomes unstable, and you start to have the bottom bone, the tibia shift on the top bone, and it causes damage to some of the other structures like the cartilage and the meniscus.
Mm-hmm. Yeah. Is there any type of winter activity that is more likely to cause this injury?
Well, we see it usually in non-contact sports and contact sports, but with a lot of agility. So anything where you're rapidly changing direction. So a lot of times in soccer, where you're coming down the field and you're trying to cut to avoid the player, or the same thing in football, basketball, when you're jumping and landing from a shot or just dribbling down the court, and you try to rapidly accelerate and change direction.
How about skiing or snowboarding?
We do see them in skiing and snowboarding, not quite as often as some of the other sports that we've talked about. In skiing and snowboarding, it's usually when you're landing from a jump and you land a little awkward, and then that's when we'll see that type of injury.
What does ACL stand for?
It stands for anterior cruciate ligament.
Say that a little slower.
Anterior cruciate ligament. So there's two ligaments in the center of the knee, and we call those the cruciates. And there's the anterior and the posterior ligament, but the anterior cruciate is the one that we see injured most often.
So the anterior is the front?
It starts in the front, that's right.
The posterior is in the back?
Correct.
And doctor, does this matter if you're regularly active, or does it matter if you're, I don't know, a seasonal? As you mentioned, soccer, but a lot of times, especially here now, we're seeing these indoor facilities. So a lot of people, and you see this with high schoolers too, they're focusing on one sport, and it's all year long.
That's right, and that becomes a huge issue, not just in ACL injuries, but in all injuries of the knee and hip and in the other joints that we treat. And we see now kids from a much younger age are focusing on a year-round sport, and you start to see more attritional type injuries. You see weakness, different tears throughout the hip and the knee, and we see these much more often. And not only are they doing one sport year-round, they're doing soccer year-round, but then they're also playing basketball and they're also playing baseball and maybe doing these more than one season. So, kids are much more active, and we're seeing a much higher incidence of injuries now because of those.
Is there anything you can do to strengthen that ligament so that you're less likely to injure it?
Yeah, it's a good question. You can't really strengthen the ligament, but you can strengthen the surrounding muscles. And one thing that we think is a huge risk factor for ACL injuries is the muscle strength around the hip and maybe some of the alignment. Now, the bony alignment we can't change. That's what you're born with. But we can strengthen some of the stabilizing muscles at the hip and the knee, and that can affect how you land. We see these injuries, like I said, when you're landing from jumps or when you're changing direction. So if we can stabilize the joint with the muscles more efficiently, then we can help decrease the incidence of these injuries. And there are different programs out there. We've worked with some of the high schools in the area, in some of the colleges, on doing more dynamic warm-ups where they get these muscles into better shape. And there's good studies out there that shows that this can drastically decrease the incidence of ACL tears.
Hamilton Orthopedic Surgery and Sports Medicine, 3 locations in our area, Hamilton, Rome, New Hartford, speaking with Dr. Russ LaFrance this morning. And Doctor, one of the questions I was thinking about early, and I kind of posed it to you, but does it matter if, is this something, and you kind of touched it, is this something that's going to happen when I'm during that sport while I'm playing that sport, or is this something that could, I could go home after, or maybe even years later because of how much I beat up, my body? This is something that could occur.
It can certainly occur later in life. The peak time we see this is both in men and women around 20. It's slightly more common in males than females. It does occur later in life. It's usually more with weekend warrior type activities at that point.
Mm-hmm.
But as far as attritional injuries that you're talking about, I played football when I was 20, but now I'm 40. Am I at risk? You're more at risk for cartilage injuries and meniscus injuries.
Sure, so things start to deteriorate and stuff.
Right.
How about treatment and recovery for ACL injuries?
Treatment, it's unfortunately it's a surgical treatment. It has to be reconstructed. It's not something that we can sew together, and it's not something that's going to heal. So we take a tendon from somewhere else in the knee typically and use that to reconstruct the ACL and use that as a graft. It's a long recovery, and it's usually 6 to 9 months before kids are back playing at the same level they were before.
All right, Doctor, how do folks get a hold of you if they want to know more about what Hamilton Orthopedic Surgery and Sports Medicine does, or one of their? Do you do similar things at all the locations, or are there specialties at different locations?
We do. Yep, we do sports medicine at the New Hartford and the Hamilton office, and they can get a hold of us at on the phone at 315-824-1250 or on the web at www.hamiltonorthopedics.com.